Every 3 minutes, a food allergy reaction sends someone in the United States to the emergency room. In an effort to avoid these allergic reactions, consumers who are managing food allergies spend more than $19 billion annually on specialty food products. Awareness is paramount. If you or someone you know is struggling with a reaction to certain foods, it may be time to get tested. Ed Neuzil, board-certified advanced practice registered nurse at Allergy, Sinus and Asthma Family Health Center, explains how they can identify and manage your food allergy symptoms.
So when we look at food allergies, they can be mild, but they can be severe, and it doesn't take much. What I typically tell people, I'd say, well, if somebody gave you a cup of battery acid, would you drink it? And of course everybody says no. And I says, well, would you just take a sip? And I let them know that it's not always a lot of exposure. It can be a very minimal exposure to cause severe reactions. The allergic reaction triggers your immune system, which activates an inflammatory process. And so individuals that do have allergies to foods and are able to avoid that exposure remark many, many times how much better they feel overall. And so that chronic inflammatory process can cause a chronic fatigue, don't feel well. Even without all the really bad symptoms, you just don't feel good. When we're talking about patients that wake up in the morning and they seem to have symptoms that they didn't have earlier, you also want to suspect the possibility of a food-related trigger, because not all symptoms occur immediately after the exposure. And that will kind of have a tendency to throw people off, because they think, well, if I'm allergic to it, I should react right away. But when we look at the allergic reaction, anything that's not normal starts to happen can be a food-related trigger. So even such things as people getting abdominal cramping, unusual bowel symptoms can be related to foods. And this can happen 4, 6, 8 hours after you've eaten, so it doesn't have to be immediate. We have several forms of allergy testing here, which can find and determine whether you have an allergy to different foods. And we usually test for the more common type foods, but what I also tell people, you may have sensitivities that are not what we call IgE mediated. So it's not an allergy, it's a hypersensitivity or an inability to process. If I test somebody and they're allergic to watermelon, they says, what's in watermelon I can be allergic to? And it's not the watermelon you're allergic to, it's the protein that's watermelon. And people that think that milk is an allergy can be, but doesn't necessarily have to be. You can have an intolerance to where you lack a certain enzyme to break down those parts in the milk. So we have not only the allergic, but an inability to process some of these foods.
To get in touch with Ed Neuzil and the staff at the Allergy, Sinus and Asthma Family Health Center, please visit our specialist directory. Just click the Testing for Food Allergies story link icon on our homepage, yourhometownhealth.com.